There we go. So this is my presentation on aminosynthesis. Slide. All right, the big question: what is aminosynthesis? It's a parental diagnostic test that examines amniotic fluid for genetic conditions. It also helps detect chromosomal minorities, genetic disorders, and fetal infections, and it's performed between 15 and 20 weeks of pregnancy. So about like the halfway mark, like 5 to 4 months. Overall, it just helps you kind of like check up on the baby's gestational period, make sure everything's going good in there. Nothing's wrong. Yeah, which leads us to the big question: how's it done? So, as you see, ultrasound transducer, so the doctor pretty much multitask a needle and the ultrasound. So they use the ultrasound to pretty much find like the umbilical cord, the fetus, pretty much all the important areas as they insert the needle to collect amniotic fluid, which they will later be used for testing, like test levels, all kinds of things, see what's going on in there. And yeah, takes about 30 minutes, minor discomfort. So it's a pretty simple, if done properly, procedure. Uh, Why is it performed? Well, it's can help in many ways by detecting chromosomal disorders like Down syndrome, Edward syndrome, also genetic conditions like cystic fibrosis, sickle cell anemia. Also checks for neural defects, spinal bifida, and lung maturity in high-risk pregnancies. So in this scenario, it's kind of a low-quality picture, but you would pretty much compare healthy levels to the levels you collected and go on from there. Like, say, if one of these are high, it could lead to Down syndrome, or if so and so is high, it could be cystic fibrosis. Really, just kind of like a comparison to try to diagnose it. And with doing this procedure, of course, there's risk and limitations. Miscarriage risk is usually 1 in 300 to 500 cases when doing the procedure or after the procedure, which can be caused from infection, bleeding, cramping. Well, infection, bleeding after procedure, cramping could be after too, but infection and bleeding could lead to miscarriages. And the big thing is emotional impact from test results. So, like I said before, like Down syndrome and all these ones could really leave a big impact on the family of the child. And that leads us to the limitations. So, it cannot detect all types of birth defects. So, it's really not a widespread, it's more like a select few, like some of the examples here too. Like those are like the couple of ones that could be found, but it can find everything. And some results may require further testing, so it's not going to be like say for instance down like if it were for Down syndrome, more testing would maybe be used in order to confirm that that's a correct diagnosis. Um, and also there's ethical concerns regarding parental genetic testing. So pretty much is the correct thing to do. It pretty much ties in with the emotional impact. So both these kind of tie together. So real world scenarios. Pregnant mother, family history, genetic disorders, undergoes endomesthesis. The result shows trisomy 21, which also is Down syndrome, which can allow early intervention. Advances in non-invasive or NIPT offer alternatives. So pretty much, there's, I guess, in some sense, ways you can kind of deal with, say, said Down syndrome. I mean, there's intense ways like abortion and all those ones, but there's also other ways to found. Ethical dilemma is should parents opt for genetic testing and make decision based on results? So that ties into the pretty much they both tie together. Personal beliefs, like what's the correct thing to do if said child has disease. In conclusion, amino synthesis provides crucial parental insights, helping families prepare for potential outcomes. Further advancements in genetic testing improve accuracy and reduce risk, and informed decision making is key for expecting parents. So overall, it could be used for good to help prevent further on problems.